Good morning, everybody. My name is Lieutenant Justin Hodges. I am an occupational therapy student, and I'm going to be giving this brief introduction on Alzheimer's disease. I know that Alzheimer's disease can be an intimidating diagnosis to receive, and so what I hope to do today is shed a little bit of light on what Alzheimer's disease is and also some of the things that can help to treat some of the symptoms that Alzheimer's disease can bring about. I'm also going to talk about occupational therapy's role specifically and how occupational therapy can benefit individuals who have the diagnosis of Alzheimer's disease. I'm also going to talk a little bit about finding balance in your life, and then I will conclude from there. So I look forward to spending this time with you. So what is Alzheimer's disease? Primarily, it is a brain disorder that impacts memory, thinking, and behavior. And I'll go into a little bit more specific on how it does that and actually some more of the impacts that Alzheimer's disease has. But I want to emphasize right now that this is not just normal aging. This isn't just having a memory take a little bit longer to remember or things like that. It's a little bit more serious than that. And so it is also a progressive disorder that gets worse over time, and there is no known cure. And so our goal with treatment and occupational therapy is to slow down the symptoms of Alzheimer and the progression of the disease. And so the things that we'll talk about later are not meant to cure or stop Alzheimer's, but slow down and assist individuals to live healthy and meaningful lives throughout their diagnosis with Alzheimer's. Now we'll be looking at what causes Alzheimer's disease, and I should note here specifically that there is not a direct cause that scientists have discovered for Alzheimer's, but what we do know is that there are a few things that are linked to Alzheimer's. The first thing, and this is what scientists can measure, are damaged cells. And so when cells within the brain become damaged, they make very small changes within the brain, and some of those changes come in the form of plaques, which you can think of as buildups, and tangles, which you can think of as twisted fibers. And if we imagine the communication structures within the brain and we imagine them like a hose, we can understand that if there are things blocking the hose, or there are things that are tangled within the hose, communication or the delivery of water in the hoses situation will be slowed down. And so this is what happens with Alzheimer's disease, is that communication is blocked. And so we can also look at various lifestyle and genetics that can lead to an increased incidence, or more cases of Alzheimer's can be tied to age. Age is a big factor, genetics, family history, heart disease, stroke, high blood pressure, and oftentimes it's even a combination of several of these factors. So you may have family history and a history of stroke and an older age, and so those may lead to an increased likelihood that Alzheimer's will be a potential concern for you. And so when we're looking at the cause of Alzheimer's, again, there's not a specific cause that we know of. However, there are these indications and things that we can use to determine the likelihood that somebody will have Alzheimer's disease. So now we can look into the actual impact that Alzheimer's disease has. And there are 6 cognitive domains, which are essentially 6 functions of the brain that Alzheimer's impacts. And so the first one is attention. Oftentimes, individuals report an inability or more difficulty to pay attention to things, especially over a prolonged period of time. Second is executive function. This is a fancy way of saying the way that you make decisions, the way that you make educated decisions. The third one is learning and memory. Memory is probably the, most well-known side effect or symptom of Alzheimer's disease. And then learning is also impacted by this disease. Fourth is language. This can be both in producing language or understanding language. And so this can be a difficulty with slurred speech or trouble finding words, difficulty understanding other people, and then perceptual motor function. And this is sort of an idea that it might be difficult for somebody to find their way back to their car. They may find themselves getting lost, even in very familiar places. And then the sixth one is social cognition. And so this can be difficulty having conversations with other people, difficulty understanding different social cues, or also reading others' body language. And so the next thing that we're going to talk about here is managing Alzheimer's disease. And what I put in bold there is I said more than medication, and that is because oftentimes medication is thought of as the only thing that can really help with Alzheimer's disease, and I think that is incorrect. So while medication can be a very useful part of the treatment of Alzheimer's disease, there are plenty of other things that we can do to manage the symptoms and to slow down the progression of Alzheimer's. And so among those things include creating a daily routine. Routines are extremely helpful for individuals who have Alzheimer's. This can reduce confusion. It can help individuals feel more secure. And so some things I would suggest are having meals at the same time every day, having bedtime be the same every day, waking up around the same time every day. They can all be helpful things. The next is staying mentally active. This can include things like reading, doing puzzles, and just simple brain activities and games. Even just having social relationships can help to slow down the progression of Alzheimer's. The third thing is physical exercise, and this doesn't necessarily have to be an intense workout at the gym. It can be as simple as going out for a walk or doing some work in the garden. There can be a wide range of physical exercises that can help with Alzheimer's. And then the last part is caregiver support, because oftentimes caregivers experience burnout after working with family members for long periods of time. It can become both physically and emotionally difficult for individuals to be a caregiver, especially if the caregiver is a child or a spouse or a neighbor. They are used to having different roles. They're used to having maybe more of, in the situation of a spouse, you shared a lot of responsibilities, and they now have not only all of their responsibilities, but also many of your responsibilities, and then are caring for the individual with Alzheimer's as well. So those can all lead to difficulty. And so what I suggest here is that a part of the plan can also be to give support to caregivers. So now we can talk about occupational therapy's specific role with Alzheimer's disease. And occupational therapy is a field that is designed to help individuals do what they want and need to do. And so with Alzheimer's disease and some of the impacts that it has on the brain, some of the daily tasks that were previously automatic or easy can become a little bit more difficult. And so what occupational therapists can do is make some of those tasks, such as eating, getting dressed, using the bathroom, showering, shaving, doing your hair, things like that. We can help to make those tasks a little bit easier. And some ways that we do that is through task simplification. We can introduce various tools to help with some of those tasks. We can also help with organizing techniques. Another big thing that occupational therapists can do is help with home safety and modifications. This can include installing grab bars in a bathroom, introducing a shower chair or something like that, or even just helping to label drawers and cabinets with pictures to help an individual understand or remember where things are kept. And so another thing, I sort of just put this under tips and tricks. Some of those can be memory aids, such as using a calendar, a list, an alarm, writing things down, and things like that. And then also just overall wellness promotion. We can help with coming up with an appropriate exercise plan or various ways to become a little bit more healthy in the way that we live. And then also caregiver education can be another role that occupational therapists can play. We can assist caregivers in some of the tasks that they need to complete, such as maybe helping with traveling or just everyday activities. And I say this because occupational therapy is backed by research. And so when compared to the usual care that individuals receive for Alzheimer's disease, those who received occupational therapy instead led to an improved performance in everyday activities, fewer psychological and behavioral symptoms, and then less time and stress for caretakers. So these are all some of the positive benefits that occupational therapy can have for Alzheimer's. And occupational therapists don't only help with sort of life essential activities like eating or sleeping or going to the bathroom. We can also help with helping individuals do the things that they enjoy, because we believe in occupational balance. And essentially what that looks like is balancing the everyday activities. When a person feels like they are unable to do anything they enjoy, this is a negative impact. This has a negative impact on their lives. And so when we balance different areas of life like work, self-care, leisure activities, and just overall health and well-being, we are happier, healthier, and we feel like we have control over our lives. And so occupational therapy, one of the goals of that is creating balance in life. And here are the references that I used to create this presentation. One that I would specifically recommend is the Alzheimer's Association, and their website is alz.org. They have a lot of good information about Alzheimer's, different care groups and support groups, and just a lot of information about this new diagnosis that you have. So thank you for your time, and I look forward to working with you in the future. Thank you.